The Mbale Clinical Research Institute is a center of excellence in clinical research, training, and innovation. This capacity has been built in 5 pillars, including infrastructure, the conduct of research, capacity building through training of staff, development of facilities, and then retaining those staff that are key and critical to the delivery of research. The Mbale Clinical Research Institute has an organogram. On top of it, we have a board of directors that oversees the policies of the institute. We have got executive director, and we have got the staff who do the day-to-day running of the institute. We started from Mbale Regional Referral Hospital serving 16 districts. We have since expanded to the Soroti sub-region, where we have added another 9 districts, and we have mapped our population to understand the burden of disease in the region. The scope of our research work includes epidemiology, pathophysiology, genetic studies, and intervention studies to understand more about the public health problems in the region. One of those is malaria, which remains very highly endemic, and it is responsible for new features of presentation such as black water fever, which have got very high mortality rate in children. Besides all of that I've mentioned, we are also involved in acute pediatrics, where we study blood transfusions, and in the study that we just concluded, that's the TRACT study, we're also able to expand our understanding on G6PD and sickle cell anemia in the region. Other than all of those, we are now exploring non-invasive modalities to study pathophysiology of common public health problems in the region using the POCUS.
Upon delegation by the principal investigator, the well-trained research team ensures that patient care, safety, as well as research activities are carried out in accordance with the set national and international ethical guidelines.
To ensure high-quality research output, we adhere to high ethical standards by having our protocols approved by local IRBs and the national IRBs, which include National Drug Authority and Uganda National Council of Science and Technology.
In research, that is paramount. Properly collected and well-managed data generate evidence and produce knowledge that influence policies and guidelines. In MCRI, we have software that manages data like Open Clinical, RedCap, Macro, and many more.
We have community engagement activities as they bring benefits of research closer to the community that promotes sustainable decisions by recognizing the needs and interests of all participants.
Mbale Clinical Research Institute has built capacity in the laboratory, especially in the molecular, microbiology, and malaria culture sections. It has a biobank of 173,000 samples.
MCRI has built capacity to pharmacy department. We have a well-established pharmacy with NDA license, which enables us to receive, store, and distribute medicines according to GCP and national regulations. We have air conditioning that helps us to maintain temperatures for storage.
The culture at MCRI is the spirit of resilience, networking, partnerships, and collaboration. We aspire to be a center of excellence for evidence-based clinical research, training, and innovation. We've been able to have funding from Wellcome Trust and a few other partnerships that have been able to help us develop infrastructure and resources for research, including a robust data network and high-speed internet connectivity with a great focused next-generation firewall with availability of services that are crucial for our research work.
In accounts department, we have built capacity in terms of human resources, internal control systems, and software, that's the Sage accounting software for efficient and effective grants management.
Other operational activities that interface with research at the Institute include general administration policies, ICT policies, human resources and staff policies, procurement and vendor management, and that is what I'm passionate about doing every day when I come to report to work.